Imagine standing inside of a pharmacy, holding a prescription that could change your health, your future, or even save your life. Now imagine realizing you can't afford it. You set it back down, you walk out, and the world keeps spinning while your health is put on pause. This isn't an exaggeration. This is a daily reality for millions of Americans. 51% of Americans cannot afford the whole bottle of prescription, while 10% are not able to even take it in their possession. Today I will be exploring a question that is not only political, not only moral, but something airing. Should prescription drugs be free? Sit back and relax while we get into the mix regarding if prescriptions should be free or not. Prescription drugs play a central role in nearly all modern medical treatments. Heart medications prevent strokes, antibiotics treat life-threatening infections, and inhalers allow people with asthma to breathe normally. These are not optional luxuries. They are critical components of human health, yet the United States continues to wrestle with the cost of accessing these medications. Studies show that nearly 1 in 3 Americans has bypassed a prescription due to the cost, and thousands of preventable deaths occur each year because people cannot afford their treatment. This creates a cycle where health declines, hospital visits increase, and long-term costs for both families and healthcare systems. While some argue that making prescription drugs free would burden government budgets, the evidence shows that free access to medications is not only morally necessary, but practically beneficial. Free prescriptions can improve public health, reduce long-term medical spending, and even create a fair healthcare system for everyone. One of the strongest arguments for free prescription drugs is the direct impact on public health. When people can afford the medications they need, they take them consistently. They manage chronic conditions, prevent diseases from worsening, and reduce the risk of emergency hospitalizations. Countries that offer free or heavily subsidized medications are the UK, Canada, and many places in Europe. These areas show lower rates of preventable deaths and fewer emergency admissions tied to untreated conditions. They save money on long-term health care because the population stays healthier. Free prescriptions are not only humane, they are an effective public policy. Prescription drugs are one of the most common sources of financial anxiety in American households. Even families with insurance often struggle with high copays or medications not covered by their plans. For low-income families, the choice becomes a cruel one: medication or groceries, treatments or rent, survival or stability. Making essential medications free removes this burden and allows families to focus on improving their lives, not constantly scrambling to manage medical costs. The high cost of prescriptions hit disadvantaged communities the hardest. Minorities, low-income close this gap and have disproportionate barriers to accessing medicine. Free prescription programs can help close this gap and ensure health is not determined by income. A society that allows people to suffer because of financial equality is a society failing one of its most basic moral duties. Opponents argue that if prescription drugs were free, pharmaceutical companies would lose revenue and reduce investment in research and development. While this concern has some basis, it overlooks important realities. Many countries' medical research recedes pharmaceutical industries and innovation continues. Additionally, much medical research, public funding meaning taxpayers already support significant advancement. Free prescription would shift the model, and it wouldn't end innovation. The question is whether companies can still innovate. The question is whether people should suffer or die because medicine is treated like a luxury item. The moral argument outweighs the financial one. With thoughtful and thorough policy planning, it is entirely possible to support pharmaceutical progress while ensuring everyone receives the medication they need. Prescription drugs are not optional. They are an essential as clean water, emergency services, and believe in protecting human life should ensure that people have access to medications required to survive and thrive. Making prescription drugs free is not just a policy argument, it is a human rights argument as well. And as long as people continue to struggle, suffer, or even die because they can't afford the medicine they need, this conversation cannot end. The direct impact on public health is an important factor on why prescriptions should be free. The UK, Canada, and many places in Europe, they all offer free or heavily subsidized medications, and they save money on long-term health care because of the population stays healthier than most. Prescription drugs are one of the most common sources in financial anxiety in American households and any other households. Families with insurance often struggle with high copays and medications not covered by their plans. Medicare rights state the Inflation Reduction Act of 2022 created a new ability for Medicare to negotiate prices for most expensive drugs and the program covers. The first set of negotiated prices will go into effect in 2026 and are estimated to save $1.5 billion in annual out-of-pocket costs for Medicare beneficiaries while saving the Medicare program $6 billion per year. The negotiated prices are a minimum of 38% of the 2023 list price. This information stated is relevant to today's society because of the prices of medication. The IRA creates a way for Medicare to negotiate prices for drugs. This makes an effort to get prescriptions at a reasonable price for purchasing. With the years of this issue and discussion, it shall go into effect in the year of 2026. According to the American Hospital Association, the inability of many patients to obtain needed drug therapies due to their high prices or shortages has negatively affected patients' outcomes. Nearly 30% of Americans say that they haven't taken their medication as prescribed due to high drug prices, and it is estimated that more than 1.1 million Medicare patients alone could die over the next decade because they cannot afford to pay for their prescribed medications. It also states the high prices for drugs and shortages of many critical drugs like chemotherapy and IV saline bags also impact hospitals' ability to provide a range of services to their communities, contributing to wider problems with access to care. Hospitals are major purchasers of drugs for use in patient care, and acquiring costly medicines and securing alternative therapies during the shortage are consuming a larger share of hospitals' finite resources. As drug prices continue to rise, hospitals have fewer resources available to finance other parts of their operations, such as paying staff and purchasing other supplies needed for patient care. This correlates with life today because of the hassle of purchasing drugs in America. The main problem families have when it comes to buying medicine are the high prices. With the prices skyrocketing, it starts to become an obstacle and a choice for those who really need to buy them. I truly think this issue should be fixed due to the rates of death and sickness. Maintaining great health is very important and should be a priority for those who control the prices. Overall, medication and prescriptions are important products for the use of everyone. Maintaining good health and staying in good condition is very important. I don't think that it is fair how prescriptions and Medicare prices are overlooked. Many deaths occur each year because of the lack of consideration. I really hope for something to go in effect to help take care of this problem. Hopefully, in a couple of years, death rates and sickness goes down from this issue. In America, prices are always going up and will continue to go up. I hope this gets solved very soon. This topic really goes into depth about medication and prescription and how it has become difficult for Americans and everyone to afford them. This conversation can never end.